Katherine Navarro, the President of the American College of Clinical Engineering, or ACCE. On this day, October 21st of 2025, we celebrate Global Clinical Engineering Day. I would like to wish everyone a happy 10th Global Clinical Engineering Day, and thank you all for your continued support of the clinical engineering field. On behalf of ACCE, I want to thank you all for your dedication to the clinical engineering profession and your steadfast determination to promote patient safety through healthcare technology management. And I would like to thank our presenter today, Jake Johnson, the chair of the Healthcare Technology Certification Commission, for putting this session together on upcoming changes to the CC certification program. I think these needed changes will help advance the CC certification program and will allow more flexibilities for you all in the field who seek certification in the CE profession. So without further ado, I'll pass it over to Jake, who will go through a summary of the upcoming CC certification program updates.
All right. Thank you so much, Katherine, for having me. I'm excited to be here with all of you today on Clinical Engineering Day. As Katherine mentioned, I'm the current chairman of the Healthcare Technology Certification Commission. And of course, we oversee our certified clinical engineering program. And today, I'm just happy to celebrate along with Katherine and ACCE, the professionals who make healthcare technology safe, effective, and reliable. It's my belief that clinical engineers, our technologists and leaders, keep our hospitals, clinics, healthcare systems running smoothly. And without your work, to make sure that our medical devices are properly managed, maintained, and integrated into care, we just couldn't have this wonderful healthcare system we have today. And today, I just want to honor the contribution and all of our volunteers who help with ACCE, HTCC, and our other organizations out there. Thank you so much. I'm excited today to make a bit of an announcement to the field. We've been working hard on improving our certification program, and Clinical Engineering Day felt like a good time to announce those changes. So the first one I'm happy to announce is that we're expanding access. And we're also trying to kind of elevate the value of the program. So we're releasing 2 new certifications. The first one is our Clinical Technology Professional, and the second one is our Associate Clinical Engineer. And we'll continue to deliver the Certified Clinical Engineer certification as we have in years past. So I'll spend a little bit of time talking about the 2 new ones, and then we have some other updates as well. So the Clinical Technology Professional, this is really going to be offered for those working in the clinical engineering field, but may not have an engineering degree. So folks with, a computer science background, or maybe working as a medical equipment planner, or maybe working as a project manager really focused in the clinical engineering space. This is going to allow them to go after our HTCC certification. It's going to be for those professionals with 5 years of clinical engineering practice. And so applications will be accepted. You need to demonstrate your years of clinical engineering practice, and then you'll be eligible to take our written exams. We're really excited to offer this. It's been something that's been requested in years past, and we're just thrilled to be able to bring this in 2026. The next certification is what we're calling the Associate Clinical Engineer. And this is going to be offered to anyone who passes the written exam. So in years past, you had to pass the written, and then you had to pass the oral exam. You didn't get a certification if you passed the written. And we, for years, have spent a lot of time and energy developing what we believe to be a world-class exam for our written exam. And so to add value to the program, we wanted to issue that certification once you pass that written exam. We're also trying to improve access by making it an opportunity that folks earlier in their career can go for. So we're reducing the years of clinical engineering practice by 2 years, so those folks can sit for that exam a little bit earlier. To get the Associate Clinical Engineer, you do still need to have an engineering education through an ABET accredited program. And then the last one is just, continuing to provide our Certified Clinical Engineer certification. The qualifications don't change here, except for, you need to pass that written exam first. You'll be coming into the CCE now, if you're a new applicant, with your ACC in hand before you take the oral exam. The next announcement that I wanted to make today is about going remote. Over the past few years, we've been offering the oral exam in a virtual, like online setting, as opposed to in person. And this year, in 2026, all of our written exams are now going to be going to an online remote platform. And so we believe those changes are going to help reduce barriers, make the exam more accessible, and just kind of modernize the program overall. It'll reduce some of the challenges with scheduling and also give us some more flexibility to offer in the future more exam windows and a little bit more flexibility when it comes to where you might take the exam and the time and date that you might need to be present. You'll also be able to take that from home, of course. And excited to announce we'll be accepting applications for all the certifications that I went through on December 1st, 2025. And with that, just want to thank you all for joining, and especially thank our HTCC and Board of Examiners members. They work really hard to try to carry the torch and honor all of the clinical engineers and all the work that's been done in the past to support this certification program. I just really want to give my heartfelt thanks to all those individuals for their time and contributions. So thank you very much, and happy Clinical Engineering Day.